When I think about breast health, I think of it as a slice of the pie, if you will, of that overall thing that we call managing and taking care of our own health. Then there's this smaller slice of the pie, which is, given the reality that 1 in 8 women in this country may develop breast cancer or will develop breast cancer at some time in her life, how do we use the various screening tools that we have? So the first one, and it's a tricky one, is that thing we call self-breast exam, which is a woman learning how to examine her own breasts and find a change or something that's different, which to me comes under the rubric of, am I aware enough of my own body to know when something's out of sync? That's what self-breast exam is to me. Most of our lives, we're outside of the screening of healthcare professionals and inside our own relationship with our own bodies, so that knowing what to do when you find a change, so that you're not so terrified and paralyzed by what you're finding, seems to be the big leap. The better you know your own body, the more you figure out that changes are happening sooner. The best way to do it for everybody, I think, is when you're with that provider. If you say, show me what you're doing, show me what you're feeling, and then do your first self-breast exam after you've had the reassurance from a healthcare professional that your exam was normal, so that you're not terrified the first time that you don't know what you're feeling. Most of us have lumps and bumps in our breast that are part of normal breast tissue. And the first time you feel that, when you've been told to look for a lump and bump, it's pretty scary. And then there are screening tests that have met the test of time that really do, at least to the best of our ability, make a difference in our being able to find breast cancer earlier. So, mammograms are not perfect. Mammograms do not find every breast cancer, but they find many more breast cancers smaller than if you were not doing regular mammogram screening. The standard of care still is that women should have a yearly mammogram. And there's still some people hashing it out about whether it starts at 40 or starts at 50. However, if you're going to do screening, it makes sense to do it once a year, starting at 40. The exception to that is if a woman comes from a high-risk family where there were early breast cancers, and a separate decision might be made with her about starting that screening earlier than that. Machinery is a little better. I think the technicians have increased in their training and sensitivity, and I tell them to take an extra strength Tylenol or a couple before they come. If you have the more dense your breast tissue, the more uncomfortable it's going to be. And there are women who need to talk to their physician about needing medication to help them relax with the setting, and that's a reasonable thing to plan. Just remember not to take the relaxation medication, whatever it is, before you sign your consent form for the procedure. At the bottom of all of this is to try to get back to not having us be a breast, a uterus, a hip, a face, a mouth of teeth, but a whole person whose parts require somewhat different engineering or different maintenance is the better way to put it. And to figure out, okay, what are the key maintenance things? I mean, to me, it's as important to say to a woman over 50, have you had a colonoscopy? As it is to say, have you had your mammogram? That it's all part of one picture about what are the things we know enough about to hugely change our lives by screening for them early.